open. Okay, so this is still class drugs for diabetes. How we are done with insulin. We actually have started with the oral hypoglycemic agents or our oral anti-diabetic agents. We started with insulin secretagogues. So from the name itself, do not forget, they have the ability to increase the secretion of insulin from the islet of Langerhans in the pancreas, specifically the beta cells of the islet of Langerhans. So please be acquainted, please be familiar with the different sulfonylureas kasi we have first gen and second generation. And then aside from that, we have the diphenylalanine derivatives and the meglitinide. And then I think we ended here with the biguanides. Actually, we only have one biguanide now, and that is the metformin. The target of metformin is the liver. It will inhibit or reduce the production of glucose in the liver. Kasi our liver, aside from the glucose, from the food that we eat, we can also get glucose supply from our liver. And that's the target of metformin. It will inhibit the production of this sugar. So therefore, the patient may experience less fasting hyperglycemia and actually lowered na postprandial hyperglycemia. We call that euglycemic agents. Kasi hindi niya talaga ipapababa masyado yung blood glucose level to the extent that the patient may experience hypoglycemia or hyperglycemia. Kasi most of the diabetic patients, class, they are not really allowed to skip meals. Kasi pag nag-skip sila ng meal, instead na bababa yung glucose nila, tataas ang glucose, blood sugar level. Tataas ha. What is the reason? So when you skip meals, remember we have stored glycogen in the liver. And this glycogen will be broken down into glucose and be taken back to the blood. That is the reason, again, na magha-hyperglycemia ang patient if mag-skip ng meal or mag-fasting. So since metformin inhibits this glucose production from the liver, then it will prevent hyperglycemia even if the patient will fast or will skip meals. But at the same time, after eating, it will also control the blood glucose level. So euglycemic agent ang tawag dyan. So ating metformin is, kaya siya pinakasikat kasi siya yung first line therapy natin for type 2 DM. And it has an advantage of, aside from hindi magha-hypergly yung patient even if mag-fasting siya, it has the advantage of not provoking increase in weight. Okay, kasi most of the patients, if they have, diba, diabetes, papayat sila. But if their sugar gets controlled, especially if they use these oral hypoglycemic agents, they have the tendency to gain weight. Now, that is not true for our metformin. Now, actually, metformin has an off-label use. When you say off-label use, it is not really included in the label of the product. Si metformin, ginagamit din siya for people who wants to lose weight, especially the obese patients. Okay, but I'm not telling you to, if you want to lose weight, I'm not telling you to use metformin. This is only used if you have conditions like severe na yung obesity mo. Yes, stage 1 or stage 2 obesity. Again, kasi it has this effect in the body that will not just increase the weight but also you will lose weight, class. However, if you are normal, like hindi ka naman talagang masyadong obese, huwag kayong mag-take kasi just like other drugs, metformin also has toxicities. So the first one that the patient will experience is gastrointestinal distress. Okay? So that will be in the form of either anorexia, nausea and vomiting, problems in the stomach like diarrhea or discomfort. Now, the the toxicity talaga na hindi natin gusto sa kay metformin is lactic acidosis. This one is notorious in impairing the lactic acid metabolism in the body. So if lactic acid is not metabolized inside, it will accumulate and it can cause acidosis. Remember, acid ito. And then pag na-accumulate siya in the body, it will cause the decrease in the pH inside, causing lactic acidosis. Remember our body class, meron tayong mga buffers kasi nga we are maintaining pH range. It's actually 7.35 to 7.45. Mini-maintain natin yan siya. Now, pag bumaba yan, nag-acidosis yung patient natin, meron din yan siyang corresponding na mga unwanted effects in the body. So, ang mga organs natin, tissues, organs, cells, our amino acids, macromolecules, or other chemicals in the body, even our ions, work only if the pH is at the normal range. And if the pH is less than 7.35 or more than 7.45, that means there will be a problem in the function of these organs also, or our tissues. So again, ito yun ha, kasi ito yung mostly gina-question sa board exam, toxicity ng metformin. It's lactic acidosis. And then contraindications of our metformin, since metformin is excreted via the kidneys, then do not give this to patients with problem in the kidneys. Okay? And then we have here alcoholism. Kasi pwedeng magkakaroon, I mean, walang effect na yung metformin if isabay mo siya with alcohol. So the patient class is number 1, magsayang-sayang lang siya sa iyang kwarta. And number 2, pwede siyang magkaroon ng toxicity. Again, because of the reaction of alcohol and the drug. And then we have here hepatic disease. Remember, the target of metformin is the liver. So, i-inhibit niya yung glucose production there in that organ. Now, if the patient has problem with its liver, tapos tinarget pa siya ng ating metformin, parang magkakaproblema tayo with our patient. And conditions predisposing to tissue anoxia. Anoxia, means no, oxia means oxygen. Okay, so just like in the patient with chronic cardiopulmonary dysfunction. So, syempre, mahirap yan huminga, yung body niyan kulang ng oxygen. So, hindi mo yan siya pwede bigyan ng metformin. Remember, metformin can cause accumulation of lactic acid, and yan yung isang magiging effect ng lactic acidosis. Usapot nagwalay oxygen ang body class. Okay, questions? Advisable po ang metformin sa pregnant women. Let's check. I'm not really familiar with the pregnancy category of metformin. Let's just check sa label niya ha. Pregnancy category ng metformin. Category B. Okay. So just like insulin, metformin is categorized as category B in pregnancy. So when you say category B, animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate and well-controlled studies in pregnant women. So it is not really classified as A kasi A talaga is considered as a safe drug. Okay? Safe drug pag category A ang drug, safe siya sa mga buntis, walang magiging effect sa baby. Pero pag category B kasi siya, yung animal studies okay. Meaning, pag binigay siya sa animals, wala siyang magiging effect or like bad harmful effect sa animals. Pero inadequate pa yung studies niya sa human. Okay, so kinategorize siya as pregnancy category B. So in this case, pwede bang gamitin? Actually, pag category B, ginagamit pa rin naman nila sa mga buntis. Ginagamit pa rin nila. Pero ano yun siya, most of the time you weigh the risk and the benefit of the drug. Okay? Anything else? Wala na? Aside from that? Sige. Now, do not be worried about hypoglycemia for metformin ha, kasi metformin among our oral hypoglycemic agents and our insulin, hindi siya nagkakos ng hypogly. Okay? Just insulin lang talaga ang ginabigay sa gestational. Most likely, it will be insulin kasi to get rid of the other unwanted effects of our oral hypoglycemic agents. Kasi our oral hypoglycemic agents, aside from like most of them are category B and some of them will be other categories, no? Aside from that category kasi may mga other side effects pa yan sila, like metformin can cause lactic acidosis, and that will not be good for the fetus also and for the mother itself. So that is the reason why pag gestational diabetes, nag-i-insulin lang talaga sila. I know someone na gestational diabetes. Talagang pag gestational diabetes kasi, you have diabetes when you get pregnant. First time mong magka-diabetes pag naging pregnant ka, talagang tataas yung blood glucose level. And one of the reason is the hormones produced during pregnancy may cause insensitivity to insulin. So again, the body still produces insulin. However, yung hormones will make it insensitive. The body will be insensitive to the effect of insulin. So to counteract that insensitivity, you may actually increase the dose of insulin just by giving the patient insulin from the outside source. Okay? Kasi if it is overwhelmed with a lot of insulin, most likely magre-react naman yan kahit at the start may insensitivity. So again, insulin lang yan siya, hindi yan siya OHA, kasi yung mga OHA natin, again, marami yan silang mga untoward na effect. Remember, insulin is being extracted from human also. Okay? Now we have thiazolidinediones. This one is the third one, oral hypoglycemic agent. The mechanism of action naman is to decrease insulin resistance. So, di ba si secretagogue, pampasecrete ng insulin para maraming insulin in the body. While si metformin is to reduce production of glucose from the liver. This time, yung mga succeeding na mga drugs na i-discuss natin is to decrease the resistance. Okay? Yan yung sinasabi ko kanina na there are people na with diabetes and their problem is they are insensitive to insulin. They still produce insulin though. Their pancreas are still capable of producing insulin, but their body do not react to insulin. So they are experiencing insensitivity or they are experiencing resistance to insulin. So ito yung drug, the thiazolidinediones. Their mechanism of action is on the PPAR gamma. PPAR is a receptor that means proliferator activated receptor gamma. Marami yan sila actually, may PPAR alpha, PPAR beta, and PPAR gamma. But in the case of thiazolidinediones, it's on the PPAR gamma which modulate the expression of genes involved in lipid and glucose metabolism. So if we are going to activate this receptor through the thiazolidinediones, it will help us with the cells na magiging sensitive na siya to insulin, and that insulin may take its effect. Pwede na niyang i-open yung mga glucose transporters in the cell para ma-metabolize talaga si glucose. So when I say glucose metabolism, I'm talking about glycolysis, which happens inside the cell. Okay, so di ba ang trabaho naman ni insulin is to help the glucose na makapasok siya sa cell and ma-metabolize siya doon. So yan yung pag i-activate mo yung PPAR gamma, matutulungan niya yung mga cells na mag-react na sa presence ni insulin. And ayun, magkakaroon na ng activity. Kaya, ang magiging labas, there will be a decrease in the resistance of these cells to insulin. What's our problem with our thiazolidine diones? They can cause fluid retention and this may increase risk of heart failure. Actually, there are really thiazolidine diones that are being withdrawn in the market now. Hindi na natin sila makikita kasi meron silang activity, meron silang harmful activity in the heart. Okay? That will be their side effect. Okay? Now, this can also make the bone fragile. So, the patient, especially for women, magiging brittle ang bones and magkakaroon ng mataas na risk for bone fractures. Okay? And then, since PPAR gamma will not just affect glucose metabolism, it will also affect lipid metabolism, then the patient may also experience decrease in the level of triglycerides. When I say triglycerides, I'm talking about oil and fats. And at the same time, HDL and LDL. HDL and LDL are cholesterols. The HDL, high density lipoprotein, are our good cholesterols, while our LDL is bad cholesterol natin yan siya. And then, it may target the liver also to cause hepatotoxicity and at the same time weight gain. So this one is the reverse of metformin. Metformin can cause weight loss, while this one can cause weight gain. Okay, and then this one is contraindicated in pregnancy. So unlike metformin, metformin is actually category B. So in some cases, you may still give that to pregnant women. This time naman, thiazolidine diones should not really be given to pregnant women because most likely ang category nito nasa D. Okay, hindi naman talaga category X. Si category X kasi talagang mag-cause ng abortion, ganon. Ito nasa D ito, na toxic pa rin sa fetus. It can cause fetus deformities. Okay, so what are the examples of our thiazolidine dione? We have the pioglitazone. I'm not really sure with the brand name sa market. Feeling ko Actos is pioglitazone. You know that I'm not really good with the brand names, but I think so. If you are going to have your duty some other time, please look at Actos. I think it's really pioglitazone. But this time, it's not just PPAR gamma na magkaroon ng activity si pioglitazone, but also PPAR alpha. But nevertheless, both of the receptors affect glucose and lipid metabolism. So especially glucose, para maging sensitive na yung cells sa glucose and magkakaroon siya ng activity. However, this should not be, this should not be given to pregnant women. This should not also be given to patients taking estrogen-containing contraceptives. So yung mga, pag sinabing ang contraceptive ay merong estrogen, it means, hindi, ito siya yung mga yung pills, I'm not really talking about like the contraceptives. Yung mga pills na may content na estrogen, ito yung binibigay pag hindi mo gustong mabuntis, kaya ang contraceptive siya, 'di ba? Tapos kapag sinabay kasi ang estrogen and pioglitazone, meron kasi silang antagonistic action. So they will be canceling out the activities of each other, especially for estrogen. The activity of the pills will be halted, and that means the patient will be pregnant if ever syempre active siya sexually. Okay, So yan yung reason bakit hindi siya pwedeng ibigay sa nagko-contraceptive. Now, aside from pioglitazone, we also have rosiglitazone. Ito yung sinasabi kong withdrawn sa market talaga because of the reports of incidents of problems cardiovascularly. So, most likely kasi nagkakos siya ng heart failure kaya talagang winidraw na siya sa market. Okay? Do you have questions about pioglitazone, rosiglitazone? We also have the other one, the one that starts with T. I forgot that one. Ano tawag nun? Troglitazone, tama. Troglitazone is another one. Please take note na lang. Anyway, their names actually end with glitazone. Troglitazone, rosiglitazone, pioglitazone. Okay? Ang tawag natin sa kanila, thiazolidine diones. Okay? Walang question. Let us move on. We have the alpha-glucosidase inhibitors. Sunod na naman ito na oral hypoglycemic agents. So, ano mechanism of action ng ating mga alpha-glucosidase inhibitor? They are inhibitors ng enzyme called alpha-glucosidases. So pag inhibit kasi yung enzyme na yan, marireduce yung pag-increase ng glucose after eating kasi nga madedelay yung digestion and absorption of sugar in the body. I don't have the illustration pala. My problem is hindi ko dala yung aking pen. Ganito kasi yun, class. Most of the time, we consume carbohydrate as starch. Most of the time, it's really polysaccharide. And it's most of the time starch. Now, question from your biochem, saan nagsa-start ang ating sugar metabolism or carbohydrate metabolism? Anong part ng body nagsa-start yon? Metabolism natin. Carbohydrate na. I'm talking about carbohydrate. Ano yan? Okay, very good. Mouth. We metabolize carbohydrates starting from the mouth. Ano meron sa mouth?
Amylase, ma'am.
Ano meron sa mouth, class? Okay, very good. It's the amylase, salivary amylase. Okay, or we call that the other name for salivary amylase is, sorry pa, this is tyalin, T-T-Y-A-L-I-N. Okay, again, that's the name of salivary amylase. Now, si starch, remember, is a polysaccharide. Now, in the mouth, if it has contact with the tyalin or the salivary amylase, this polysaccharide will be reduced to oligosaccharide. Diba ibig sabihin ng oligosaccharide? Diba natutunan nyo neto sa biochem ninyo? And even sa review, I believe you are done with biochem sa review. Hindi ko si Chris siya yun. yung ano, yun yung reviewer. Oligosaccharide class is 3 to 4. 3 to 4. 3 and up. 3 to 10 na mga glucose units. Okay, 3 to 10. So example niyan is the dextrine. Pangita sa kung agyo, I don't have my pen class, naiwan ko sa bahay. Okay? Dextrine or pwede din maltotriose. Okay? Maltotriose. That's different from maltose. Maltose is a disaccharide. Maltotriose is an oligosaccharide. It contains 3 sugar units. Okay? So, yun yung mangyayari kapag kasi starch ma-digest ng salivary amylase. Pero remember, we cannot use dextrine pa rin or the maltotriose kasi this one is a big molecule. So, pagdating naman inside sa gastrointestinal tract, this oligosaccharide will be metabolized. So, di ba meron tayong tinatawag na pancreatic amylase. Okay, aside sa salivary amylase, meron din tayong pancreatic amylase. Nire-release yan siya ng pancreas natin to further metabolize these oligosaccharides. And one example of a pancreatic amylase is the alpha glucosidases. So dito yan siya, class, si alpha glucosidase. Ginagamit natin siya na enzyme to further metabolize this. If we are going to break down our dextrin and our maltotriose, what we are going to achieve here or produce here is glucose. Okay? And ayan na, meron ka ng glucose, it will be transported to the blood, and from the blood, through the help of insulin, it will be transported into the cell, undergo glycolysis for us to have the source of energy. That's the process. Okay? Now, anong mangyayari sa gamot na ito, yung alpha-glucosidase inhibitor? Siyempre, inhibit the enzyme alpha-glucosidase and you will just have the oligosaccharides. So there will be a obstruction or a delay in the digestion of our sugars. Okay? And at the same time, kung hindi siya na-metabolize, hindi mo ma-absorb si glucose, hindi siya mapupunta sa blood, and hindi tataas yung blood sugar level. I hope naintindihan yung work ni alpha-glucosidase. Do you have questions before we'll move on to the specific alpha-glucosidase inhibitors that we have in the market? Pero ito yung mechanism of action yan. Question, alin dyan yung hindi naintindihan? Wala. Hintay dito, ha? Sige. So, kung wala, ito yung mga natin, class, alpha glucosidase inhibitors. The miglitol, which is more potent in inhibiting the sucrase. So, si sucrase is another enzyme though. This is still alpha glucosidase inhibitor, ha, si miglitol. Inhibit niya pa rin sa alpha glucosidase para hindi ma-digest yung ating starch, yung ating oligosaccharides. Pero yung kanyang action compared to alpha-glucosidase is 6 times more potent in inhibiting the sucrase. Si sucrase naman, from the name itself, sucrase is the enzyme in our body required to metabolize sucrose. Okay, our table sugar. Pero again, the same pa rin yun, hindi siya ma-metabolize, so walang glucose, etc. Walang tataas na glucose sa blood. And then yung mas ginagamit na alpha-glucosidase inhibitor natin in the market ngayon, si acarbose. Brand name nito sa market, ang pinaka-common is the glucobay. Manambok ang patient pag mag-take og alpha glucosidase inhibitor. Not really. Hindi talaga siya tataba kasi nga hindi niya madadigest yung starch. So, ang mangyayari, yung starch, yung oligosaccharide, nandun siya sa intestine. Kaya kung titingnan natin, ito yung magiging adverse effects niya. Magkakaroon ng problem in abdomen, in the stomach itself. There will be diarrhea, abdominal pain, and flatulence. In short, wala ka natunawan. Actually, ang action lang talaga ng ating mga alpha-glucosidase inhibitor, no? Kung ito na siyang i-simplify, wala ka natunawan. Wala ka nakadigest sa imuhang gikaon. Kasi we are inhibiting the enzyme used for digestion. So, mo na nga maglain imong tiyan, class. Remember, imuhang gikaon, no, example, ang imuhang kanon, which is made up of starch, wala ni mo siya na-digest. So, sakit imong tiyan di ba? Kita pag dili na makadigest, may sakit ang atong tiyan. So, ana lang, and mai-excrete lang siya as is. So, ang tendency, the patient may experience hypoglycemia kasi wala na siyang na-absorb na glucose. So aside from the problem with the gastrointestinal tract, pero hindi talaga tataba kasi wala ka na-absorb na na carbs. Pero I'm not saying na mag-take kayo ng acarbose ha. Kay normal man inyong blood glucose level. Kasi gusto lang dyan yung magkaon ma'am, daghan, carbohydrates. Tapos, pero dili na mo siya gusto ma-absorb. Kapag ma-absorb na mo siya, mataas ang blood glucose level o kaya pwede ni manambok. Kaya diba ang glucose inside the body, pwede siyang i-convert as glycogen. And at the same time, kung sobra-sobra na, i-convert natin siya as fats and ma-deposit siya sa adipose tissues. O kani kay di man siya ma-absorb. So, pero dili, pwede ha mainom mo. Kaya remember, you may experience hypoglycemia with this. Wala ka na nambok, pero mamatay ka kay wala kay sugar, wala kay carbohydrate in the body. Kaya wala na nimo siya na absorb. Okay? Questions or clarifications? Kasi yun lang talaga yung sa glucose inhibitors natin. Wala. We are almost done. Ayun na yung mga group of oral anti-diabetic drugs nga very commonly used. Itong mga naiwan, mga other agents na lang ito, though they are also used, pero they are not really commonly used in the community. So we have the first one here, the pramlintide, which is an analog of amylin, which is an injectable. So we give this. This is the reason why it is not really used that much, no? Kasi injectable kasi ito. So amylin is one of the hormone substance na nire-release in the pancreas, and it has something to do with how you are going to use your glucose as a source of energy. Now, if you're going to give amylin to the patient, this will modulate postprandial glucose levels. So, ma-activate din kasi yung ating insulin with this one. So, if you are going to eat the carbs, the glucose na kinain mo class, will really be used as a source of energy. Hindi siya magsistay and mag-accumulate in the blood. So again, ginagamit siya before kumain yung patient, mag-inject muna ng pramlintide. Tapos pagkatapos niyang kumain, hindi ka mag-expect na tataas yung blood glucose level nila. So this is for both type 1 and type 2 diabetes. Okay? Now, ang adverse effect niya, di syempre, ginagamit talaga yung glucose, no? So, the patient may experience hypoglycemia. Mauubusan din naman siya ng glucose kasi used up. Yeah, inject before magkaon. Para siyang insulin din, si pramlintide. So, this one is an injectable. When I ask you about adverse effects, side effect, toxicity, do not give me nausea and vomiting ha, kasi that is very common to most of the drugs. Most of the drugs can really cause nausea and vomiting, especially at toxic levels. So, ako niya tagaiging anak, kumangutan ako sa inyong haog, side effect. Okay? Ang wala na nagka-cause of vomiting class kay ang anti-emetic. From the word itself, anti-emetic, anti-suka. Wala nagka-cause of vomiting. Okay, and then we have exenatide, which is an analog of glucagon-like polypeptide 1 or GLP-1, which is our first incretin therapy. But just like pramlintide, this is also an injectable drug, so not really used that much in the community. But ito kasing si pramlintide, most likely this one is on the usage of glucose as a source of energy. Talagang ma-utilize yung glucose, no, ma-metabolize siya. Insulin resistance will also be reduced. This time kasi si exenatide is para siyang insulin secretagogue. So if you're going to give this to the patient, it will trigger the release of insulin. So mag-i-increase yung insulin secretion in the body. Adverse effects or side effects, you still have your anorexia and your weight loss, and then you have here the pancreatitis. This may cause inflammation of the pancreas. Kasi nga, yung target niya nito, pancreas, papabilisin niya yung pag-labas, pag-release ng insulin. And then we have the sitagliptin. Marami ito sa market. Janovia is sitagliptin. Janovia Met is sitagliptin plus metformin. Kindly check though, I'm not really sure with that. No, kaya sabi ko I'm not good with brand names. Pero sali siya. Ano yan siya? Drug for diabetes pa rin. So, oral hypoglycemic agent pa rin siya. Pero ang target niya is not the same with the other oral hypoglycemic agents that we have, kaya nakaseparate ito. So ano naman yung target ng ating sitagliptin? This is an inhibitor of the DPP4 or dipeptidyl peptidase 4. This is actually an enzyme that will degrade incretin and yung other pa na GLP-1 like molecules natin. Ito kasing si incretin and yung mga molecules na GLP-1 like, GLP means this one, glucagon-like polypeptide. Ano kasi sila, activator sila ng glucagon. So pag na-activate, diba, baliktad kasi ang trabaho ng insulin and ng glucagon, diba? Si insulin, yung glucose mo, papasok niya sa cell para mag-glycolysis and you will have energy. Si glucagon kasi, magdadala siya ng glycogen sa blood. So yung example, yung glucose ang dadalhin niya sa blood. Ang example, yung glycogen na nasa liver natin, i-breakdown yon with the help of glucagon. Glucagon is also a hormone just like the insulin. So i-breakdown yun siya, and then pag nag-breakdown si glycogen, magiging glucose, and then ibabalik siya doon sa blood. Yun kasi yung trabaho talaga ni glucagon. So yan yung trabaho ng incretin and other GLP-1 like na mga molecules, and i-inhibit yan. Baliktad, si incretin and si GLP-1, i-inhibit niya si glucagon para hindi magbe-breakdown yung glycogen and then magkakaroon ka ng glucose. So pag na-inhibit si glucagon, wala kang more supply of glucose in the body. Okay? Pero kasi si incretin and si GLP-1 like na mga molecules, dinidegrade din sila sa body using that enzyme, the DPP4. So hindi sila makaka-inhibit ng glucagon, no, kung dinigrade sila. Kaya i-inhibit natin using the sitagliptin. Okay? So we have here decreased postprandial glucose excursions. Ganun pa rin naman siya. Ibibigay siya before kumain yung patient natin, para pagkatapos niyang kumain, hindi ka makapulbaan na mataas ang iyang blood sugar level. Okay? So iklaro ko lang kay murag baliktad akong giingon kagayin na si incretin og this one will like inhibit glucagon, pangita sa kung glucagon activity. Okay? Para dili ka magkaroon og more supply sa glucose. Kaya lang again, kani sila na mga substances gina-degrade ani nga enzyme. Sa atong himuon, inhibit nato ang enzyme para walay mag-degrade sa ilaha. Magtaas ilahang level, magdaghan sila, and makatrabaho sila. Okay? This one, ilahang work. Ang ending, magbaba imuhang blood sugar level. Okay? Side effect, nasopharyngitis can cause inflammation in that area, nasal, pharynges, and then URTI, upper respiratory tract infection, headache, and other severe allergic reactions. Yan lang yung problem natin with the sitagliptin. Okay? Kasi kasali na yun sa effect sa activity nitong mga molecules na ito. It's not just about the glucagon, the blood sugar level. They may also affect the immune system. So magkakaroon ng ganitong mga reactions like allergies. Okay? Okay, that's the end of the slide. Do you have questions sa ating oral hypoglycemia, mga anti-diabetic agents natin, starting from insulin. Please study also glycolysis. I might or might not include this in the exam. Kasi aside sa pharmacology, sa module 2 sa board exam, kasali ito. You really have to be familiar with this. From glucose, naging pyruvate. Actually, pyruvate will be converted into acetyl coenzyme A, and then yung acetyl coenzyme A, yun na yung papasok sa Krebs cycle. And sa Krebs cycle, doon natin makikita yung pagka-produce ng maraming ATPs. Okay? Questions or clarifications? Insulin, different types of diabetes mellitus, ano pa, oral hypoglycemic agents. Wala. So yun na yun lahat ha. We started with the insulin secretagogues. We have 3 sulfonylureas, meglitinides, diphenylalanine derivatives, and then we have the biguanides, thiazolidine diols, yung nag-decrease ng resistance sa insulin, si alpha-glucosidase inhibitors. That's the name of the enzyme na ginagamit natin actually sa pag-digest ng ating carbohydrates. And then incretin-based therapies to inhibit our glucagon and to increase our insulin activity in the body. That's the same thing with the amylin analogs, which are injectable just like our insulin. Our insulin are administered in the body subcutaneously. We only have the regular insulin na ginagamit intravenously. Okay? So yun, summary na ating oral hypoglycemic agent. Yeah, isang yan sila, isang family. This one. Ito ha, sitagliptin. The linagliptin is a newer drug, but they have the same mechanism of action, inhibitor of the dipeptidyl peptidase 4 enzyme na ginagamit to degrade the incretin and other GLP-1 like molecules. Okay? Anything else? Wala na.